As a neurodivergent with complex trauma who works with fellow neurodivergents with complex trauma, something that comes up in our clinical work is the importance of distinguishing between emotional discomfort and emotional endangerment. Often in therapy, when we do the deep internal work, a nerve will be touched, either by the process of therapy itself or by the therapist and their attempts to work with you. And this can be highly triggering. It can provoke old feelings that are rooted in trauma, and it can lead to many of the trauma-related responses. Fight, flight, freeze, fawn. You might lash out at the therapist. You might want to run away from therapy. You might shut down emotionally and disengage. And you might put the therapist on a pedestal and revert to people-pleasing techniques. And that's all an attempt to cope with that perception of emotional endangerment. Now, there is a spectrum, and therapy can bring up a lot of discomfort, but it doesn't necessarily mean that you are in danger. Barring malicious intent by your therapist or insensitivity or a failure to attune, a therapist for the most part is going to try. I believe most therapists have good intentions and are trying to do good work with you. I would hope so. Granted, a lot of therapists are not trained and are not neuroaffirming, and there's a real risk that they can engage in behaviors that emotionally endanger you, for sure. So I don't want to discount that. That's a reality. But I know, speaking for myself, if this happens, if we get into the territory of discomfort, that's an opportunity for many things. First of all, for you to speak to what you're feeling, to process it collaboratively with the therapist, to share your fears and your anxieties, to seek comfort, empathy, compassion, containment, and attunement. Letting the therapist know, giving them an opportunity to reattune to you and your needs, to provide those things, to make you feel safer in therapy, to bridge the gap that often in the past you weren't able to bridge, and it led to shutdown, and it led to emotional and sometimes relational breakdown. If you can sit with that discomfort and breathe through it and not rush towards a reaction, and if you are working with a therapist who is neuroaffirming and neuroinformed and has the skills and the empathy to work through it with you, you can come out of that reactive state, and you don't have to escalate. Well, internally, you don't have to perceive an escalation towards endangerment. You might be able to go, okay, this is uncomfortable, but I'm not in any immediate danger. And maybe if I can learn to work through the discomfort, healing can happen. And what often happens with many people who are neurodivergent with complex trauma is we want to revert to those trauma responses. We want to defend ourselves, protect ourselves with the strategies we know how to use. And these strategies can become maladaptive, especially when they're not coupled with a situation that involves endangerment. It might involve that discomfort, but not necessarily endangerment. We want to adapt to perceived threats and not necessarily be engulfed by the discomfort, and learn to live with it. So that maybe, hopefully, through co-regulation, through healthy, reciprocal relationships with people who hold a space for us, who are tuned to our needs, we can come to a place of acceptance and greater inner peace. And one of the challenges in healing is that if we revert back to those responses, rather than developing coping skills, rather than reaching out, rather than striving for growth and healing, we remain mired in those responses and things don't progress. And it's very hard to come out of that state. And we end up scanning our environment all the time, being hypervigilant, anticipating attack, anticipating danger, maybe misreading that in our environment and jumping at shadows, and shutting down the possibility of co-regulation, of establishing relationships with people who can help us co-regulate. Have you struggled with this as a neurodivergent person with complex trauma? Have you found that often you misperceive endangerment when there's just discomfort and you want to revert to the fight, flight, freeze, fawn type responses? And has it protected you? And also, how has it possibly hindered you? I would love to hear all about your experiences.